Good evening and a warm welcome to all our followers on social media. Thank you for joining in for this extremely special webinar. May 5th, 2023 was commemorated as World Pulmonary Hypertension Day. Many of you may ask, what exactly is pulmonary hypertension? Yes, indeed, it is a frequently misdiagnosed and often undetected form of hypertension which needs to be discussed and delved into in great detail. Not only are we commemorating this day in a special way by organizing a seminar, a webinar like this, we are also using this as our opportunity to salute the numerous people who are living with pulmonary hypertension in their lives. In order to help us understand a lot more about this little understood or probably misunderstood disease, I have with us here a very large and expert panel of doctors. On behalf of Times of India, in association with Emerson Laboratories, I'd like to welcome Dr. Ravikant Patil, MD, DM, DNB Cardiology, FACC, FSCAI, FESC, AICT, Asia PCR, Consultant Intervention Cardiologist, Seva Southern Group of Hospitals, Miraj. Doctor, welcome. Dr. Akshay Bhapna, MBBS, MD, DGM, DM Cardiology, FESC, FCSI, FACC, Professor and Head of Department at Government Medical College, Kolhapur. Dr. Vikrant Vijan, DM Cardiology, FESC, MD, Medicine Gold Medalist, and Chief Intervention Cardiologist at Region Hospital and Research Center, Nasik, and Unicare Hospital, Pune.
Thank you.
Dr. Rajendra Vasant Patil, MBBS, MD, DNB Cardiology, Intervention Cardiologist at Jupiter Hospital, Pune.
Thank you.
Dr. Anand Vijay, MBBS, MD, Pulmonary Medicine, AFMC, IDCCM, Senior Consultant, Pulmonary Medicine at Aditya Birla Memorial Hospital, Chinchwad, Pune. Dr. Venkatesh Deshpande, MBBS, DTCD, DNB, Respiratory Medicine, Consultant Chest Physician and Intensivist at Dr. Hedyawar Hospital, Aurangabad.
Hello and thank you.
Doctors, you need to commend me for getting all those right.
Yes.
There were so many. So here itself, we have an extremely learned and qualified panel of doctors here with us to tell us more about pulmonary hypertension. I'm going to begin right away with my first question to Dr. Ravikant Patil. Dr. Ravikant, please tell us, what exactly is pulmonary arterial hypertension?
Good evening, and thank you, Emerson. Thank you, TOI, for this pleasant evening. Pulmonary arterial hypertension, let me explain in a very layman's language what it exactly. We all know that heart has got the two compartments. One is on the right side and one is on the left side. Like there are four compartments, but there are two sides of the heart, right and left. The right side of the heart takes up the impure blood, what we call as the deoxygenated blood, and it pours into the lung through a pulmonary artery. And in a pulmonary lungs, the blood gets oxygenated with the oxygen what we take into the lung, and it pushes into the left side, and from left side it goes to a whole body. So what we talk about the hypertension is the hypertension which, you know, for a layman's language, hypertension is an arterial hypertension. It is a systemic hypertension. What is a less known fact is there is also a pulmonary arterial hypertension, means the hypertension which occurs into the lungs. And this is because of any damage, any issues with the lungs causes the increase in the pulmonary artery pressure, which is supplied from the right side of the heart. Generally, it is less than 25 millimeter of Hg. If the blood pressure goes above 25 millimeter of Hg, that is called as the pulmonary arterial hypertension. That is the hypertension which occurs on the right side of the heart into the pulmonary artery, which is supplied by the right atrium and the right ventricle. So this is all about the pulmonary hypertension.
Thank you, doctor. I think that was very simply put, so all of us could understand. Thank you for that. My next question is to Dr. Akshay Bhapna. Dr. Akshay, how common exactly is pulmonary arterial hypertension?
Yeah, thank you so much, and warm good evening to everyone. Well, the common of pulmonary hypertension, as Dr. Ravikant Patil has already explained about how the blood pressure of the lungs increases, and that's result into pulmonary arterial hypertension. Now, well, pulmonary hypertension can occur in a small kid also. I'm to say a small newborn neonate also, and it can vary till at the elderly age of 80 years, 90 years. We have seen it. Well, if you see if the age group of less than 1 month, we see the incidences of almost 0.5 to 1%. That's called as an pulmonary hypertension of newborn. But when the age increases, this subsequently it goes on decreases, and usually this might get subside by 6 weeks in kids. But certain cardiac heart problems, I mean to say, when there are something shunts or there is when something holes in the heart, that can lead to further increase in the pressures inside the lungs, and that can cause in pulmonary hypertension. Their prevalences and incidences is somewhere around ranging from 1% to 3% overall in the kids. Well, in India, these incidence and prevalences are relatively more, as we have got little bit of developing countries. And we have found out in various studies, particularly in Kerala study, which is a very big study which was done. And it said that the prevalence and incidence is relatively 1 to 2 times more as compared to the whole globe. Well, when it comes to the adulthood, after 18 age, that becomes somewhere the prevalences increases from 5% to 35% across India. And all over the globe, it comes somewhere around to 10%. So in short, if I goes with these numbers, it is a little confusing. But what I can say you that this disease starts from the newborn and it can touch it to the elderlies also. And it's very, very, I can say it was used to say it's not an uncommon, but nowadays we see it relatively very common, particularly in the post-COVID era.
So, Dr. Vikrant, my next question is to you. Could you tell us who is at risk for PAH?
Yeah, so very important question. Generally, to answer this question, I would like to tell that the person, either they would have something that is known as primary hypertension, PAH, or secondary pulmonary arterial hypertension. So primary or idiopathic. Idiopathic means you don't know the cause. So this is more common in the women, especially in the 30 to 50 years of age. Then there can be secondary causes. So these are the people who are at a higher risk to develop pulmonary arterial hypertension. So that means there is a particular cause, and because of that, you are getting pulmonary arterial hypertension. So there can be many causes. It can be because of respiratory cause like chronic COPD, asthma, and sometimes even because of heart shunts, you can have elevated pulmonary arterial pressures and PAH. Also, sleep apnea, which is becoming more and more common now, obstructive sleep apnea, OSA, can lead rise to PAH. There are also certain drugs that cause PAH that you should be taking care of, note of. Also, certain autoimmune disorders and chronic inflammatory disorders like rheumatoid arthritis, SLE, over a period of years, they can also develop PAH. So it is multifactorial. These are the kind of people you would be suspecting and you should work out for PAH.
Thank you, Doctor. In fact, that does cover a rather large span of probable suspects, we may say. Dr. Rajendra Kapil, can you tell us, is PAH hereditary?
As Dr. Vikrant had just said that there is one specific type of pulmonary hypertension which is called as primary pulmonary hypertension. It's specifically seen in the females. Yes, in that case, it is hereditary seen and the disease can be passed from one family to the another family. For the primary, for the secondary, it may not. So yes, the answer will be yes, but for one specific type, it can be passed.
So anyway, if there is somebody in the senior generation who has that particular kind of pulmonary hypertension,
there needs to be evaluated for the pulmonary hypertension in the subsequent progeny, whoever is coming, specifically on the female side.
Understood. Thank you, Doctor.
Thank you.
Dr. Anand, could you help us understand what are the factors that can cause or contribute to PAH?
Ma'am, as already elaborated by many of our speakers, eminent speakers, there are many reasons why a person particularly develops this pulmonary hypertension. So there are many diseases. They involve our lungs. They may involve our heart. They can involve our whole body. So with the point of view of pulmonary side, there are many lung diseases. Any lung disease which can increase the pressure inside the lungs or can destroy the lung parenchyma, the lung tissue, can cause pulmonary hypertension. Like there are diseases, COPD. It is very prevalent nowadays. So COPD, it can destruct the lung parenchyma, lung interstitium. So it can increase the pressures in pulmonary vasculature, pulmonary arteries. There are some heart problems, heart defect. So by that way, our left heart is more stronger. So if it is communicating by any birth defect with the right side of the heart, the pressure transmits into the pulmonary vasculature. So it can also increase the pulmonary hypertension. In heart failure condition, chronic heart failure, in that thing, the left heart is not pumping the blood properly, so the back pressure transmits into the lungs. So it can increase the pressure in the lung arteries. Then there is a very common disease which is often, like, it is very common in the society, in which some clots they form in the lungs arteries. They generally form in the lower limbs, but then the clot transfers to the right side of the heart and then it is pumped into the pulmonary arteries. So then there is a blockage to the flow. So it can also cause pulmonary hypertension. And in certain condition, this clot is creates a chronic sequelae, chronic consequences. So in these patients, we call it chronic pulmonary arterial hypertension. So these patients, they have this pulmonary hypertension. Some form of systemic diseases, like already narrated by previous speaker, like rheumatoid arthritis, we call it generally Sandhivat. So in these diseases, there is destruction of or hypertrophy of the muscles of the pulmonary arteries. So it can also cause pulmonary hypertension. So many of people, they suffer from arthritis, so they can have this type of phenomena. Liver cirrhosis, like if your liver is destroyed by anyhow and it goes into a cirrhotic form. So in these cases also pulmonary hypertension can develop because it forms some arterial and venous connection in the lung tissue. So there is a direct transmission of the high pressure blood to the right side of the thing. There is a connection. So it can create pulmonary hypertension. HIV infection can cause pulmonary hypertension. Some people, they misuse the drugs. They take drugs like cocaine or methamphetamine. Some athletes may take it. So these drugs also can cause pulmonary hypertension. And then nowadays there is a very common thing which we are encountering, the obesity. And this obesity causes a sleep apnea problem. These patients, they develop abnormality of breathing while they sleep. So because of this, also pulmonary hypertension in these patients can develop. So there are many factors, many causes, many etiologies of developing pulmonary hypertension, which are very common, but they are often diagnosed very late.
Thank you, Doctor. Dr. Venkatesh, may I ask you, now that we've discussed what could be the probable causes, now can we talk about what are the symptoms of PAH?
Very disease where in the early part of this disease, the person will not experience any symptoms. But as the disease progresses, the commonest symptom is shortness of breath. The person feels like short of breath. And this short of breath or shortness of breath is progressive in nature. Secondly, this patient may feel sometimes chest pain. Sometimes the patient may feel palpitations or some discomfort in the chest. These patients do get easy fatigability, and they will get fatigue with a moderate exercise or mild to moderate exercise. With the advanced disease, these persons develop swelling in the neck, what we call it is the edema of the feet. That can be swelling of the feet, swelling of the legs. Even these patients may develop bluish discoloration of the lips or tongue, that we call it as a cyanosis. So these are the common symptoms we see with the pulmonary hypertension. Always remember that in the early part of this disease, patient may not experience any specific symptoms. Thank you.
And that is very important actually, because this could,
Yes,
could it manifest at any point in time?
As the pulmonary hypertension progresses, it nears to 30 millimeters of mercury, or sometimes in a very sensitive patient, patient may feel early fatigability. Then, if the routine investigations are showing normal results, then we shall think, or you shall plan to investigate for the pulmonary hypertension.
So, Dr. Ravikant, can you tell us therefore, so now that we've discussed this and how, as it goes further, the symptoms become more evident and apparent, what are the complications if this is not treated? Doctor, you're on mute, please.
PAH can actually cause a lot of complications, and that's the reason why I think we are talking today, because it goes into different kind of a complication. To summarize it, why the complications occur in two ways. One, because the pulmonary arterial hypertension puts a pressure on the right side of the heart, and because of the constant increase in the right-sided pressure, the right heart fails. And so whatever complications occurs because of the right-sided failure are the symptoms of the complications of the pulmonary arterial hypertension. Secondly, forward, when there is a pulmonary arterial hypertension, there is a fixed cardiac output because heart is pumping against the pressurized tube. So the output, the right heart output is fixed. So whatever the symptoms occurs because of the right heart, fixed right heart output, that is another point of a complication. So complication occurs basically because of these two mechanisms.
Understood. Thank you, Doctor. Dr. Akshay, can you now let us, it's not because we want to, put the fear of all this in anybody, but our listeners must know and our followers must be aware. What are the complications, if we were to ask you, of PAH? What are the complications?
Yeah, it's a very important question to understand, because most of the time they will present to the medical attention would come only after a complication has occurred. And like we say, blood pressure and diabetes are silent killers. Pulmonary hypertension may have, because the prevalence is very common in females, and still in women in India, they usually try to tolerate the symptoms. So the complications what we usually face, or probably we should be aware about, is number one is patient come into extreme breathlessness. The swelling would be there. There would be a lot of fluid retention would be there. You'll have all the legs swollen. Then this is what is called as a right-sided heart failure. Second complication, you may have a vomitus of blood. That's what we call as an hemoptysis, and we may have a sputum coming up with a blood stain, and that's the reason it becomes because of the bleeding tendencies that happens. Number third, we can have abnormal rhythm problems. That is what you can have extreme palpitation episodes. Your heart rates may vary. Most times it will be on a higher side, and that may lead to acute breathlessness or very high intensity of pounding of the heart, and that will make an immediately bring down to hospital attention. Apart from this, you can also have the clot formations. That's very important, because as blood pressure itself is the risk factor for formation of the clots. Similarly, in pulmonary hypertension also, it causes a clot formation in the lungs, and that can be very dreadful also. Ultimately, overall, if you see, these are the very important features that can be present, and that is the reason it becomes important to address to a nearby well-trained doctor to find out and get the diagnosis at earliest to prevent this complication.
Thank you, Doctor. Let's move on now. Dr. Rajendra Patil, can you tell us, maybe it sounds like a silly question, but I'm sure that as a common man who comes across this, is it curable? Doctor, you're on mute, please.
sorry. Whenever it comes to the treatment, there are two parts. One is whether we can cure the disease or we can treat the disease. Because when we see it's a curable means we can eliminate that disease completely from the body. And cure is for the to prevent the complications, to reduce the symptomatology and have a better life. It's a treatment. So if you ask me for a pulmonary hypertension, if there's one specific like pulmonary embolism because of blood clots, then some patients of them can be cured, can be treated. But many of the patients, since it's a genetic process and there are many diseases, they are kind of congenital and chronic, it can be treated, this can be cured completely, but they can be treated in the sense that we can reduce their symptomatology. We can, with the medicines, with the new procedures, we can reduce their complications, and at the same time we can slow the progression of the disease, so that the life and the movement can be ensured for the good quality of life. So in short, it is treatable but may not be curable.
Thank you. Thank you for being honest, because it's very important for everybody to know the reality of how this works and how this disease progresses. Dr. Anand, my next question is to you. In the next question that I'm going to ask, I am going to discuss the various treatments. But before that, from you, I just want to know, is the treatment similar for all patients of PAH?
No, ma'am. Treatment is not similar because of the causes of pulmonary hypertension. They are different. So when a patient is diagnosed for pulmonary hypertension, the doctor simultaneously diagnoses him for the reason also. So for what reason it is there. So there are many causes. I have already narrated the causes. So treatment will depend upon what has caused the pulmonary hypertension. Like for example, if it is caused by chronic obstructive pulmonary disease, that is COPD. So we need to treat patient for COPD, which has caused it. Like if the patient is of some systemic disease like rheumatoid arthritis or some scleroderma or something like that, or if he's having any heart failures, chronic heart failures, so we have to treat for that thing. In some of the cases, the pulmonary causes of pulmonary hypertension is not known. They are called idiopathic cases. So in those cases, we give certain medications to reduce the pressures inside the lungs. But frankly, it will require a different treatment strategies in every patient as per the cause. So it differs among
Thank you,
patients.
doctor. Yeah, thank you. So that is also extremely important information. And therefore, my question to Dr. Venkatesh is, what are the treatment options for PAH?
Yeah, actually, just now Dr. Anand and Dr. Ravikant has told regarding the primary part of pulmonary hypertension and secondary. Secondary which is occurring secondary to some other illness, and the treatment depends on the primary cause or secondary cause. This treatment can be in the form of pills, it can be in the form of sprays like inhaled medicines, or it can be in the form of injections, which can be given through the veins or which can be given in the skin, that is subcutaneous. So various forms of medications are available. In last 2 decades, there are lots of advancement on the diagnostic part as well as on the therapeutic part, that is treatment part. So depending upon the underlying disease, whether it is idiopathic or primary, which has no reason and only the pulmonary hypertension is diagnosed, then there are a lot of medications which are used. And in the secondary type of pulmonary hypertension, we need to treat the underlying disease as well as pulmonary hypertension simultaneously.
Thank you, doctor. Before we go any further, I want to step back for a minute. Now we are talking about the various kinds of PAH that exist, etc. But let's step back for a minute. Dr. Vikrant, can you tell us how exactly are these various versions of the disease diagnosed? How do we come to a conclusion about them?
So there are various tests that we commonly use to ascertain the cause for the diagnosis of PAH as well as the etiology. So commonly, what we normally do in our routine OPD practice is that we do certain blood tests. like HIV, complete blood count, thyroid tests, and then there is a panel wherever suspected, like for the diagnosis of autoimmune disease like SLE, scleroderma, and rheumatoid arthritis, because they are also positive factors for developing PAH. And then there are these other tests like ECG, chest X-ray, CT scan. Very importantly, I would like to add is the use of echocardiography, that is a heart scan that actually ascertains the PA pressures, whether the patient has got elevated pulmonary artery pressures, and also certain things that have already been told, like if the patient is in failure, the patient has got worsening breathlessness. Is the right heart is not contracting that well? So does he have any RV dysfunction? All these things are picked up on an echocardiogram. And based on patient to patient, there are further tests like even cardiac MRI, VQ scan that we also use for the diagnosis of PAH.
Thank you, doctor. I think that is very critical as well, to know how exactly this needs to be diagnosed and discovered as to what form of PH the patient is suffering from. Well, now that we've discussed the treatment options as put across very succinctly by Dr. Venkatesh, Dr. Ravikant, can you help us understand, are there any other supportive therapies for PH?
Such as Dr. Venkatesh already told that there are different treatment options of the PH. So if you talk about the supportive therapy for the PH, the most important supportive therapy is oxygen. The oxygen, whatever we give either by the direct nasal route or we give it by the ventilators, like non-invasive ventilators. Both the ways, it causes the pulmonary arterial dilatation. The oxygen is a supportive thing. If it is like lack of oxygen causes the pulmonary arterial constriction and pulmonary arterial hypertension. If you give oxygen to the patient, either directly or by the ventilator way, by the non-invasive ventilation, it causes the pulmonary artery dilatation and reduces the pulmonary artery pressure. This is the one important supportive therapy we always talk about when we talk about the pulmonary artery hypertension. And secondly, all my colleagues, as they told that there is something called as a primary and secondary hypertension. There is something called as acute and chronic hypertension also. The acute hypertension conditions like pulmonary embolism, fat embolism. So in this pulmonary embolism, nowadays we are using the mechanical thrombectomy, like pulmonary arterial thrombus suction. So recently at Seva Sadan, we are doing a study with the Penumbra, is a new device. We have done almost 35 cases with this device, where we take out the clot which is causing the pulmonary artery hypertension in acute condition. So that is also a supportive therapy. Rather than doing a surgery, we can do a mechanical thrombectomy and we are doing a randomized trial on that. So these are the different supportive therapy. And as well, there is a surgical therapy also which can be used as a supportive therapy for the treatment of a pulmonary arterial hypertension.
Thank you, doctor. So we basically discussed the different kinds of treatments. We've discussed supportive therapies as well. Dr. Akshay, could you tell us, please, apart from all this, what are the lifestyle changes that one needs to make in order to cope better with PAH?
Yeah, it's again a very important, because it's a day-to-day thing that we should inculcate in our habits, so that can reduce. And as some of our colleagues have mentioned it very clearly, curable and treatable. So curable things, I'm going to say, when we talk about the lifestyle modifications, you should have an good healthy diet. That is what consists of low salt intake and almost less than 2 grams per day. You have to quit smoking. That's very, very important, including the passive smoking. Tobacco intake has to be stopped down, because it's one of the very, very important reasons, as Dr. Vision has clearly mentioned, COPD and asthmas that get worsened. After that, we should have an adequate water intake because in heart failure, particularly complications, you cannot use excess of water intake into that thing. So you have to customize or individualize the amount of water intake as per your expert and the person you take. Very important. After this, you should have a regular exercise that will increase your effort tolerability, because the 6-minute walk test, what we usually do perform to detect the pulmonary hypertension, effort tolerance. That's very, very important. So a person should walk on a distance as per his effort tolerance. When he starts getting breathless, you have to stop it. Next, you have to take one step ahead and see you tolerate, you rehabilitate yourself and do the well. So these are the very important lifestyle modification things you have to do. And last but not the least, a very important thing is obesity has to be well controlled. That is, your weight reduction plays a very, very vital role. Make sure your height and weight matches very properly. It usually goes for a layman term. If someone wants to know what should be my ideal weight, it should be around 10 to 11 kgs per foot, whatever you have. So imagine if you're a 6-foot person, your weight should be around 60 kg to 66 kg at maximum, plus minus 5 kg. So just a basic formula you should remember, so that it will take care of your body mass also, and will also help us to improve the symptoms of this.
Thank you, Doctor. I'm going to ask my next question to Dr. Vikrant. Doctor, now that we've also discussed what are the lifestyle changes that need to be done, perhaps a very big aspect of lifestyle is the food we eat. And especially in today's day and age of the Zomatos and Swiggies, I think we need to be mindful about it. So could you kind of elaborate a little more on what are the types of food that we should be consuming at this time?
Very important question, because it has to go to all the patients who are living with PAH. So eating the right food that provides good nutrition is important, and it can manage our patients better. So what is generally recommended is that you should eat high fiber food like whole grains, bran, fruits, and vegetables. Then eat food rich in nutrients like potassium, magnesium, and vitamins. Like Dr. Bafna has just told, you have to monitor your sodium intake and monitor the fluid intake. So generally, salt intake should be reduced. Imagine as the disease progresses and the patient becomes breathless and they have signs of heart failure. That means they get breathless when they walk. Sometimes they get lightheadedness. So you have to be very careful with the fluid management. And sometimes the fluid will have to be restricted based on patient to patient. And again, very importantly, control your salt intake. So these are a couple of things that we should advise to our patients, but eat healthy and a good balanced food is the key.
And that makes sense actually, because this is something that we have to live with for the rest of our lives. So it's ideal to have a sustainable approach even to the food that we eat. Thank you so much, Doctor. Dr. Rajendra Patil, let me ask you something, similar to, this is not about the kind of food, but this is about the precautions that should be taken while eating our food. So is there anything that that patients should be mindful about?
Yes, because as we are discussing that pulmonary hypertension is the problem from right heart failure. So that will increase the pressures on the right side, which will eventually get reflected into the intestine. And from the intestine, the food get absorbed. So the rate of absorption is actually decreased when you are having pulmonary hypertension. So if you eat a large food like a twice a meal kind of thing, large food at one point of time, even it's a high nutritious food, the intestine won't be able to absorb such kind of food. So it's always to have better small frequent meals for those patients with pulmonary hypertension rather than large meals at this one time, so that the intestine gets the time to absorb all these micronutrients and the nutrition whatever is needed. Here again, the fluid also plays, the water also plays dual part. Like in one, as we are saying, it should not be more that we need to do diuretics to decrease the fluid, but at the same time, it should be adequate so that dehydration should not be there. So again, as a previous Vikrant and everyone said, it has to be individualized. And as we said, that food has to be eaten slowly and chew thoroughly, because that will also increase the absorption of the food from the intestine. And of course, the salt management is required.
Do you think patients with PAH have a higher possibility of aspirating their food? Is that also a reason why they should eat slowly?
Rather than aspirating, when we, the actually digestion starts from the mouth. Like if you chew it properly, all the saliva get mixed in the mouth only, and all the lipase and all the enzymes start working there, and the absorption, or the, you can say, the digestion starts from there. So as we know already that intestine have been engorged with the all the pressures, so they won't be able to digest that much. So if it gets given time, the food is already semi-digested, will go to the intestine, and that it will be easier for them to absorb the nutrients. Otherwise, you are taking the all micronutrients, you are taking all the minerals, but intestine is not able to absorb that thing. That's why it has to be very slow process, frequent process, and small process all the time.
Fair enough. Thank you, Dr. Patil. Dr. Anand, please tell us, now that we've spoken about food as well, and since physical activity is also a very important part of a lifestyle change, what are the kind of physical activities that you would recommend?
See, ma'am, physical activities are always required. But these patients, they have a compromised system because of pulmonary hypertension. Their lung does not absorb, or is facing much pressures. It cannot absorb oxygen to the great level. Some patient of the pulmonary hypertension, they eventually develop hypoxemia, which is a lack of oxygen. Like their saturations, it may remain lower, below 92% or something. So it depends the level of what is your level of pulmonary hypertension. In short, any person who is having pulmonary hypertension, he should avoid any kind of heavy physical exertion, because during at the time of heavy physical exertion, our muscle requires more oxygen. Okay, and during that time our BP rises. So our BP rises, then subsequently pulmonary hypertension will also be rising. So these patients, any of the patient of pulmonary hypertension, they must avoid any kind of physical exertions, like going to the high altitudes or lifting heavy weights or running for long. So, but the activities are also required. So low level of aerobic activities like walking slightly fast, it is recommended, because they have to keep their muscles active also. So very low level of aerobic exercises which doesn't consume oxygen very fast, doesn't put load on the system. So they are recommended for these patients. If anybody is having his oxygen levels on lower levels, like some patients, they develop hypoxemia. So these patients can also do exercises, but they use supplemental oxygen at the time of the exercise. So basic idea is to put pressure as less as possible on the system, and do the exercise simultaneously.
I think perhaps, if I may use the terminology, moderation is key in these aspects as well. Dr. Venkatesh, today's day and age has an entire breed of young professionals and young middle-aged professionals who have decided to overcome COVID by traveling all the time. So everyone is on the road, either for work or for leisure. What are the precautions you would advise for PAH persons, patients who need to travel?
Yeah. Part of this question is already answered by Dr. Anand just now. The thing is that, just to repeat, these patients shall avoid or visiting high altitude places, so that they will not face the oxygen deficiency. At the same time, these person shall avoid deep sea diving also, like scuba diving, deep sea diving, where again they may face a deficiency of the oxygen. And if you take the high altitude, even people staying or residing at high altitude do also develop pulmonary hypertension after a few years. That is a complex phenomena. And the person who is already diagnosed with pulmonary hypertension shall also avoid visiting high altitudes, or shall take precautions before planning for the air travel. And as already Dr. Anand has mentioned, that if these people wish to go ahead with the traveling plans, they shall carry their supplemental oxygen cylinders, which are the portable cylinders, along, so that they will not face any complications during the traveling.
Thank you, doctor. So, but primarily it is about the oxygen intake, especially during travel, that is a cause for concern, isn't it?
It's like going at a high altitude or going down inside the sea leads to the change in the atmospheric pressures, and that will ultimately affect the oxygen absorption inside the body. The person is already compromised with the oxygen concentration inside the body, that is hypoxia or hypoxemia. So these persons may develop more oxygen deficiency if the atmospheric pressure changes while going on high altitudes or having a deep sea diving like. So they shall avoid these challenges or these type of challenging traveling.
Thank you, Doctor. So, Dr. Ravikant, as part of our, in the initial part of our discussion, we did touch upon the fact that a lot of women are affected by PAH. So, then obviously the next question that comes to my mind is, what about pregnancy and PAH in women?
Very, very important question actually. pH and pregnancy. It's not only a medical thing, it is also huge social impact is affected because of this pregnancy and pulmonary arterial hypertension. If you ask me if there is a pulmonary arterial hypertension, we will say no pregnancy. That is our first and insisting term to a patient, that if there is a fixed pulmonary arterial hypertension, please avoid pregnancy. But then it's not that simple. The question, when is asked, there is a social status. There are so many personal issues associated with the patient. If it is patient's first pregnancy, just we can't say that you cannot go for a, you cannot have a pregnancy, something like that. So then we have to decide whether it is a reversible pulmonary arterial hypertension or it is an irreversible pulmonary hypertension. What happens is most of the times before marriage, there is, like there's a congenital heart disease like ASD, or there's some valvular heart diseases which causes the pulmonary arterial hypertension. Most of the times in rural India, parents and the girl try to hide this from the husband. So then when they land into pregnancy, then they will, it is revealed that there is some heart problem to them. Then if it is a reversible condition, we treat the condition and we ask them to go ahead with the pregnancy so that there won't be any issue. But it is a fixed irreversible pulmonary arterial hypertension, irrespective of their personal issues. As a patient, we advise them not to have a pregnancy. So that is how it is individualized for every patient.
You won't be winning any popularity vote when you advise, especially from families, I'm sure. I'm sure immediately they'll jump to the next doctor to get
Exactly.
an favorable opinion. Yeah, so it is a big social issue as well, I'm sure, and not an easy one for you as doctors to handle.
Yes.
Yeah, so my heart goes out to you and to the patients who have to listen to such verdicts. Dr. Akshay, we're almost at the end of our webinar, and we want to talk about only one last factor, which is the role of vaccinations in the management of PH. Could you kindly dwell on that for us, please?
Yeah, just before going to this question, I'll just add to what Dr. Ravikant has added. Now, one of the another aspect which is very important is about the contraceptions, which we have to be very clear about telling them, because certain OC pills can worsen the scenarios, and we have seen a lot of blood clots formation do happen. So such females should be discouraged to have the such OC pills, or probably we should use the selective OC pills, which consists of, that is oral contraceptive pills I'm talking about, which consists more of progesterone. But still we should inculcate them to use a barrier contraceptions, that is use of condoms and copper teas and etc. So this is one of the very, very important aspect, because we do see a lot of youngsters, they come and they take a counseling, and that's a very, very important part. I'm just to add up to this, I think Dr. Ravikant has already spoken very beautiful on that topic. Well, coming to my question, what you have asked about the vaccination, and yes, it's very, very important, and particularly the value of this vaccination has come up after the COVID drive, and it's very important that pulmonary hypertension patients are immunocompromised. Their lungs are getting weaker and weaker. So they are more susceptible to have more recurrent respiratory tract infections. And that's the reason it becomes very important that prevention plays a very important role for such infections. We do have very commonly pneumococcal infection related pneumonias, and lower respiratory tract infection. So we have got a vaccines for it, something called as a pneumovac vaccine, which you can take and prevent those. You can also definitely to have a COVID vaccine and anti-respiratory syncytial virus vaccines such as influenza vaccines, etc. So these are the some important vaccine. I'm sure the doctor who is treating the concerned patient should make sure, and also the patient should be made aware that just with this vaccination, the recurrent hospital admission rates of that patients will be definitely avoided in a large number. That's very, very important.
Absolutely. And I really believe that that works so much more towards preventing, stalling, slowing the entire deterioration of the disease or the disintegration. Before we leave, I'm going to ask each of you doctors to kindly give a word of advice or hope or consolation to the patients out there, to your patients, and to everyone who's following us. So let's start with Dr. Venkatesh Deshpande. Doctor, what would you like to tell your patients?
Yeah, sorry, I was mute. Please do come forward for the details of the investigations when your shortness of breath is not under control. And don't be afraid that lots of medications are coming and lots of researches are going regarding the pulmonary hypertension. Don't be afraid. And in India, like the European countries, we don't have any pulmonary hypertension association. They got a pulmonary hypertension association so that patient interact amongst themselves, and they got a caretaker doctor who gives consultations, and lot of modifications can be done for the lifestyle, as well as the person with hypertension can live happily in spite of this dreaded disease.
So they have like support groups, is it?
Support group, yeah.
Okay. Yeah, makes sense. Yeah. Dr. Vikrant, can we hear from you, please?
So, just like how Dr. Venkatesh has told, it's a very important message that should go to all the patients, that though it is not so common, but it is not so uncommon as well. So whenever you have certain symptoms, you should consult your cardiologist. There are these very basic tests that we normally do to detect PAH. And one of the most important things is that there are such wonderful drugs, therapies that are available now, that are available in our country, and there are such good counselors. So with this, the morbidity, mortality, your people are living longer, and even the functional quality of life improves. So this is one very important take-home message I would like to tell all our patients: do consult and take the advantage of the therapies that are available.
Thank you, Dr. Vikrant. Dr. Rajendra Patil.
Yeah, just addition to or extension of the whatever Vikrant said. A stitching time saves 9. So it's like the same thing that if we can diagnose them earlier, because if they ask for the consultation and if they diagnose earlier, then we can control the symptoms, we can slow down the progression of the disease so that can have a better lifespan. And with that, this is really possible with the all new investigations, with the new modalities of the treatment. But the importance is that the person should come forward, seek the consultations and really follow the advice. And of course, if there is a peer group, then it is more possible for them. So better early diagnosis is much better for them.
Absolutely. Dr. Anand.
Everything has been told by the previous speakers so clearly. Just want to say that anybody is having pulmonary hypertension, he should remember there are treatment options nowadays. Okay, and whatever life he is living now, it can be made more better. So whenever you are having any symptoms, like particularly the breathlessness problem, or any you have been diagnosed with any of such conditions which have been told, so please go to a doctor, ask for this particular thing, and they should believe that the treatment will make their life more better, whatever they are living now. So they should not lose any hopes.
Thank you, Dr. Anand. Dr. Ravikant, I'm going to add a twist when I ask you the same question. I'm going to say, what would your words be for the patient and for the bystander?
I just say, don't lose hope. We are there to treat you. That's all.
Absolutely. Short and sweet, but absolutely on point. Dr. Akshay, how about you? Doctor, you're muted, please.
Yeah. So be healthy, always be happy, and whatever we are living with the life, give them a positive vibes.
So nice. What a lovely note to end on, indeed, because at the end of the
There is
day,
a nice song in Hindi. इतनी शक्ति हमें देना दाता मन का विश्वास कमजोर होना. You should believe in yourself. विश्वास कमजोर नहीं होना है.
Yes.
Yeah.
Correct.
Thank you.
I choose to believe that Vishwas is two ways. One is ourselves and the other is up there.
Absolutely.
So, and the third is here in front of me, you doctors. So thank you so much, dear doctors. It's been a wonderful 1 hour of listening to you, sharing your amazing advice and experience with us. On behalf of Times of India and Emerson Laboratories, I would like to place on record my warm gratitude and appreciation to Dr. Ravikant Patil, Dr. Akshay Bapna, Dr. Vikrant Vijan, Dr. Rajendra Patil, Dr. Anand Vijay, and Dr. Venkatesh Deshpande for joining us today to talk about pulmonary arterial hypertension. To all our followers out there, stay healthy and stay happy, like Dr. Akshay said. But more importantly, always remember your doctors are here to help you, to treat you, and to give you a much better quality of life. God bless you and good evening. Thank you.
Thank you.
Yeah. Good night. Good night, everyone.
Good night.
Good night.